Hello, in this video we will be looking at viruses, specifically the novel coronavirus or COVID-19, and we will also look at the risk factors and how it currently relates to the situation involving President Donald Trump, as well as wrap it up by talking about the treatment that he has received thus far and what to expect while he's in the hospital. So stay tuned. Hello, and if you're new here, welcome. If you're not, welcome back. I am Dr. Jack, and today I wanted to get out a quick video sort of discussing the novelties of the coronavirus and specifically COVID-19. I wanted to get this out only because we recently found out that President Donald Trump as well as Melania Trump have been diagnosed with the virus, as well as several of their staff members. So I thought it was important just to kind of review this at this time. And we will start off by sort of discussing viruses and what makes them unique. They are actually quite fascinating. And I originally thought I was going to be an infectious disease doctor, actually, because I was so amazed by how viruses as well as bacteria interact with the body. And viruses are very unique because what they do is they hijack your body's own cell mechanisms. And once they get into the cell, they start replicating the material. I know that many of you probably liked the original high-tech demo, so I have it here again for you today. The coronavirus actually has all these spikes, exactly like this. And what they do is they help attach to the surface of a cell. So imagine a cell, and this is the COVID-19 virus. And what they do is they come along, by the way, cell's a lot bigger, but they have to attach at a receptor on the outside of the cell. And that receptor is known as the ACE2 receptor. And this particular receptor, there is quite a bit of it at the very bottom of your lungs at the small little air-filled sacs called alveoli, which I've spoken about in past videos. And that's sort of where the air as well as the air interacts with the circulation within your body. So the ACE2 receptors are abundant within the lungs as well as places like blood vessels, which is why people that are getting infected with this virus seem to have a higher chance of blood clots. As well as in the kidneys, it's found in the GI system, it's found in several different organs. What ends up happening is that when it enters the cell, or any virus for that fact, it injects its own genetic material into it and starts hijacking the cell's own sort of machinery, and it's typically known as ribosomes. And what it does is it starts replicating and making more of the virus for release to go back out and start infecting other cells, and it just kind of keeps propagating itself the entire time. So what makes the COVID-19 virus so deadly is that when it attaches to these receptors at the bottom of your lungs, and it disrupts that entire area and puts you at higher risk for things like pneumonia and what's called ARDS, or acute respiratory distress syndrome. And that is due to the fact that there's so much inflammation and destruction that at those air-filled sac level, that there is real issues with getting oxygen and into your bloodstream. And this is why people start becoming very short of breath. Just ARDS in general carries with it a mortality rate anywhere sometimes from 27 to 45%. So what makes the coronavirus so unique, or specifically the COVID-19? And what makes it so unique is the fact that there is such a long incubation period where somebody can be, well, several things make it unique, but this is one of them, where you can walk around and sort of be asymptomatic, and you can present with symptoms anywhere from 2 to 14 days later. And during that time, you are able to transmit the disease to others. And take the flu, for example. I mean, if you get the flu, typically within a day or two, you're developing symptoms and you know it and you're staying home. So your ability to transmit the virus unknowingly is much, much lower than with the COVID-19 virus. and also just the way that the virus causes severe inflammation within your body through the mechanism that I talked about. And there are other risk factors that make you more susceptible as well, which we should dive into also. So what are risk factors, and specifically we'll talk about these and how it relates to President Trump at this time. So what we know is that if you have severe lung issues or any type of real organ issues, whether it's kidney or the heart, that it can obviously exacerbate things. And as far as I know, President Trump has been documented that he has some mild heart disease, but none of the specifics were ever given. I don't know if he has any diabetes because that is considered a risk factor. I do know that he is considered obese, which means that he has a BMI or body mass index of greater than 30. That's a number that's obtained when you sort of do a mathematic formula taking your height as well as your weight into account. Other thing is that he, I would imagine, has high blood pressure, just given his age, the stress of his job, as well as his weight, but he very well may not. That's just a guess on my part. Essentially, the risk factor that he has is number one, his age, number two, his weight, and probably some mild heart disease, and especially in the form of if he has like hypertension, which can obviously put stress on the heart. Therefore, I would probably say that President Trump is at about a mild to moderate risk for having a serious issue while battling the COVID-19. So next, let's talk about the treatment that we know that he has received so far. So we know that he has received two different types of treatment, and one of them is called remdesivir. And remdesivir actually has been around for a little while. It was used to treat MERS as well as SARS infections, and the coronavirus actually has a similar kind of structure to it. And so it's being used for treating COVID-19 as well. And what it does is basically blocks the ability of the virus to replicate within the cells and creates issues for it, so that it kind of attacks it at that ribosome level that I discussed earlier. It is considered a broad spectrum antiviral. And the other treatment that we know that he has received is a cocktail of antibodies. And this is an experimental drug actually created by a company called Regeneron. And it's called REGN-CoV2 is the name of the cocktail of antibodies. It was made in a lab within mice who were genetically altered to have the immune system similar to humans. And they kind of mass produce these antibodies, and the antibodies will attack the foreign body in the form of an antigen. And an antigen is basically what's defined as anything that is a foreign substance that causes an immune reaction to take place within your body. And that foreign substance can be bacteria, viruses, chemicals, or even pollen. And when your body's presented with an antigen, these cells called B cells go into action, and basically what makes the antibodies to help whatever foreign invading molecules there are. And so what they're doing here is basically injecting the antibodies directly into the circulation and helping the body's own antibodies fight the virus off. And what they're doing here is basically attacking the virus from two ends. They are injecting antibodies to help the body fight the infection, as well as trying to block the replication once it gets into the cell and disrupt it at that level as well. And on top of that, they're probably giving dexamethasone as well, which is a steroid that's typically given around 6 milligrams a day. And what that does is, as any steroid does, is decrease inflammation. So what is likely taking place at the hospital, and why is it a good idea to be in the hospital aside from the obvious? They are monitoring his vital signs and watching for something called hypoxia, which is a reduction in the amount of oxygen that's in your blood. Again, if that air to circulation interface is disrupted, it has issues with your body getting enough oxygen. So it's extremely important to monitor that. And there was reports that, the reason they went to the hospital was because of the fact obviously for closer monitoring, but there was some reports of shortness of breath. You know, when I saw him leave the White House, get on the helicopter to go to Walter Reed and get out, he was actually moving at a pretty good pace, which is obviously good news, and you know, did not appear real short of breath. He looked fatigued, but you know, going to the hospital is obviously definitely the right call. And while there, they can do things like take chest x-rays or even do CAT scans to kind of take a better look at the lungs and anything else that they need to closely monitor it. They can also give preventative measures to prevent things like blood clots, while at the same time, they can also aggressively give him good hydration to kind of flush out his system. And obviously, if anything goes wrong, you know, they have all these specialists there, cardiologists, you know, ICU doctors, pulmonologists, critical care, everybody is there to take care of him. So I just want to close with some final words here, and that is, you know, it breaks my heart to see our country having the political divide that has occurred in this day and age. And regardless of your political affiliation, I hope that you are keeping, you know, our president as well as our first lady and anyone actually that has obtained the virus within your hearts, your minds, and your prayers, and hope for everybody to have a safe and speedy recovery. And so with that, I will leave you guys. We will resume sort of our other videos here shortly, but I just thought it was important to get this video out as quickly as possible. So till then, stay safe, take care, bye-bye, Pura Vida.